Hi, and welcome to the 8th Annual Telehealth Summit of South Carolina. My name is Darra Coleman, and I'm delighted to be with you today to briefly discuss telemedicine and COVID-19, the impact of emergency orders from the South Carolina Board of Medical Examiners. Very briefly, as you'll see on the next slide, we need to cover a few disclaimers, as we always do when we provide information from attorneys. Next slide, please. The COVID-19 pandemic is an unprecedented and constantly evolving fluid situation. So the legal and regulatory issues arising from the pandemic are novel and comprehensive. Nothing in today's presentation is intended to constitute legal advice or to create an attorney-client relationship. So let's take a moment to look briefly at where we are and where we've been. So looking back, let's evaluate and just recall how we got to where we are today. We began with the declaration of a public health emergency on March 13th at the federal level when President Donald Trump issued the proclamation. And after the federal declaration was issued, almost immediately at the state level, Governor Henry McMaster declared a state public health emergency by Executive Order 2020-08. And both of these proclamations are available via hyperlink here. Now, the state public health emergency is very important because that triggers certain authorities for our various state agencies. And in this case, it triggered certain authorities for law enforcement, for the Emergency Management Division, but most importantly for our purposes today, it vested the South Carolina Department of Health and Environmental Control with broad authority pursuant to the Emergency Health Powers Act. And under the Emergency Health Powers Act, once a public health emergency is declared, DHEC is vested with very broad powers over both facilities and individuals. DHEC has regulatory authority over healthcare institutions located throughout the state, including hospitals and long-term care facilities, and also bears the responsibility of directing public health activities to control the spread of the infectious disease. So now we know how we got started with the declaration of the public health emergency. We need to evaluate where we are in the midst of the public health emergency some 7 months later. At the federal level, looking nationally, according to the data provided by the CDC today, which was updated just yesterday on October 12th, bearing in mind that we're recording this presentation on October 13th, even though you're going to be viewing it on the 23rd. There were 7.7 million total cases in the United States, a little over 214,000 total deaths in the USA, 344,300 cases in the last 7 days across the country. At the state level, we've had 157,406 total cases in South Carolina. I looked at the DHEC website today, and we've actually had a little higher number at the state level, but that data just hasn't been reported out. By the time you will see this presentation, these numbers will be higher still. The total deaths in our state are 3,552, and new cases reported in the last 7 days are 5,824. Notably, according to the data reported to DHEC from our schools, we have approximately 1,100 cases as of today comprised of students and staff members. As of today, we have COVID cases on the rise in 32 states. This information tells us that we're unlikely to have the end of the public health emergency declaration anytime soon. This information lets us know that the waivers and exemptions that we're going to be talking about as they apply to telemedicine are unlikely to be lifted anytime soon, but we have to keep in mind that as they are written now, they are temporary measures. Next slide, please. Bearing in mind that the public health emergency proclamations were issued on the 13th, it's important to know that both the State Board of Medical Examiners and the State Board of Nursing immediately went to work the very next day and issued separate orders waiving the licensing requirements for out-of-state providers, including nurses, physicians, physician assistants, and respiratory care practitioners who were invited into the state by DHEC. And essentially what the regulatory board said is that if DHEC, under the Emergency Health Powers Act, determines that your services are needed because of the public health emergency, then we're not going to stand in your way. We're going to let you come into the state to practice. This waiver by DHEC has been utilized by a number of healthcare practitioners in bordering states to practice via telemedicine. And I've worked directly with hospital employee practitioners who are practicing with facilities along the border who are offering telemedicine services. And it has been a wonderful and very useful tool because there have been patients, for whatever reason, who are unable or uncomfortable traveling to hospitals or hospital-owned practices and who want to be evaluated and treated. Additionally, it's been very valuable to employers who want to make services available to their employees via telehealth. So the process is quite simple. If you are a provider who wishes to be considered for a DHEC waiver, which means you do not have to go through any application process at all with a regulatory board, then you reach out to their volunteer coordinator and you provide a list of the licensees who can provide the service. You confer with their volunteer coordinator to see if your services are needed, and you provide a roster of the licensees and verification of their licensure in your home state. It has been a very painless process for the providers with whom I have worked, and if you have any questions about that particular process, I'll be happy to walk you through what I've been able to do for my clients. This has worked really, really well. Again, bearing in mind it's worked for folks who are close to the South Carolina border. For you also, it might be helpful to keep in mind that this is useful not just for NDs, nurses, PAs, nurse practitioners, respiratory care practitioners. There are some other regulatory boards who have also engaged with DHEC, including counselors and dentists, who have also indicated that they are willing to waive licensure requirements if DHEC indicates that there is a necessity for their services. And so this process is working quite well. There is a separate process, though, for licensed clinicians from out of state who wish to apply for a 90-day temporary license. Those people are not looking for an indeterminate waiver by DHEC. Those people want to come before the board or through the process and have a term-limited temporary license. They can go through the actual online application process via the hyperlink that's recorded here, and pursuant to the governor's announcement back in March, the goal of the medical board is to process those temporary license applications within 24 hours. So that is an expedited, streamlined process as well. In addition to these waivers and the expedited temporary license process, the BME issued 4 orders during a special called meeting later on in March, addressing 4 specific telemedicine issues. All of these orders were issued on March 22nd, and these relate to the requirement for a board appearance before prescribing Schedule II drugs via telemedicine, the establishment of the physician-patient relationship prior to prescribing for hospice patients, the requirements governing the collaborative relationship of nurse practitioners and PAs who are practicing in the border states of Georgia and North Carolina and providing care to patients located in South Carolina, and finally, the practice of telemed. So let's first look at the requirement for the board appearance before prescribing Schedule II drugs via telemedicine. In its order specific to this situation, the BME listed the requirement that prescribers appear before the board to obtain express authorization prior to prescribing Schedule II or Schedule III medications via telemedicine when the practitioner-patient relationship is established solely via telemedicine. And that mandate is set out by statute in the Telemedicine Act of 2016. Under this emergency order, the following circumstances must be met. The prescription must be issued for a legitimate medical purpose by a practitioner acting in the usual course of his or her professional practice. The telemedicine communication is conducted using an audiovisual, real-time, two-way interactive communication system. And the practitioner is acting in accordance with applicable federal and state laws. And finally, it's important to note that this order restricts the waiver to licensees who are actively licensed in good standing and who are physically present in the state of South Carolina. It does include physicians, physician assistants, and APRNs if they are appropriately authorized in their written practice agreement or their scope of practice document. The next order authorized hospice providers to establish the physician-patient relationship via telemedicine for purposes of prescribing during the public health emergency. This temporarily modifies the board position, which has been held since February 2016. Under the old holding, any licensed physician who is an employee of or under contract with a Medicare certified hospice program with a qualified hospice program director may prescribe up to a 14-day supply of medications for a certified hospice patient for the purpose of controlling symptoms prior to establishing a traditional patient-physician relationship by a direct physical exam. Due to the COVID crisis, hospice providers informed the medical board that they were concerned that they would be unable to establish an in-person examination in order to prescribe, and they were concerned that the patient needs simply could not be accommodated without the intervention of telemedicine. So this particular order was intended to ease that burden on both providers and patients to allow providers to establish the physician-patient relationship via telemedicine. Unfortunately, even though COVID has changed how we do business and experience life in so many ways, it has not changed the advent of cancer and other terminal illnesses that require hospice care for patients. And so this measure was intended to provide comfort to those patients who need hospice services. The next order was also intended to address a very specific need. So as many of you know, the statutes in South Carolina have been amended in 2018 and 2019 to specifically address the practice agreements and scope of practice guidelines for APRNs and PAs. In this particular emergency order, the BME relaxed the enforcement of certain requirements regarding PAs and nurse practitioners engaged in practice with physicians in the border states of North Carolina and Georgia. The board was informed that South Carolina patients who had already established care relationships with providers across state lines were encountering concerns and problems in seeking care, and they could benefit from having telemedicine relationships and encounters with those non-physician providers. The medical board evaluated the collaborative relationships and the frameworks that are made available in both North Carolina and Georgia and concluded that although different, North Carolina and Georgia provide substantially similar regulatory frameworks, and finally concluded that during the public health emergency, that the medical board, with the consent of the Board of Nursing, would be content during the public health emergency to rely upon the collaboration and supervision of the physicians in North Carolina and Georgia and the sufficiency of the clinical agreements in those states, essentially as substitutes for the written practice agreement and scope of practice guidelines in South Carolina. So the board hereby suspends enforcement of the requirement that an NP or PA licensed in good standing in North Carolina and or Georgia enter into a practice agreement or scope of practice guidelines, respectively, with a physician licensed in South Carolina who is actively practicing medicine within the geographic boundaries of our state. Nurse practitioners with the approval of South Carolina Board of Nursing and PAs licensed in good standing in South Carolina or for whom licensure requirements have been waived may treat existing patients in South Carolina via telemedicine, subject to the terms of their applicable agreements or protocols with their supervising or delegating or collaborating physicians in North Carolina or Georgia. And of course, that language is to reflect the statutory language of the applicable jurisdiction. Further, those practitioners licensed and in good standing in North Carolina or Georgia may prescribe Schedule II and Schedule III medications to existing patients in accordance with Board Order 2020 BME PH03, which we've just covered, if otherwise authorized by law and subject to any requirements imposed by any other regulatory agency, including DHEC. The order relates to the suspension of enforcement of the practice agreement or scope of practice guidelines and collaborating or supervising physician requirements and matters incident thereto only. All other provisions of South Carolina law remain in effect. And the final emergency order touching upon telemedicine relates to the prescribing of telemath, which is the telemedicine prescribing of medication-assisted treatment. The medical board has established that as its standard of care, it prefers an in-person evaluation and assessment prior to the prescribing of medication-assisted therapy. However, a presentation was made and a petition submitted by the director of DAODAS for reconsideration of this position during the public health emergency. Upon consideration of this, and also bearing in mind that the board had previously required practitioners who wish to prescribe via telemedicine to appear before the board, the BME addressed the use of telemedicine and determined that during the emergency, the use of telemath was restricted to those who had already been BME approved, but identified an expedited approval process for additional providers to initiate care through petition through DAODAS. So practitioners who are previously approved by the board may, in accordance with state and federal law, initiate MAT treatment for patients who are diagnosed with an opioid use disorder via telemedicine without the need for an in-person visit, provided that the initiation of MAT is documented in a patient's chart and the practitioner sees the patient in person within 60 days after the end of the public health emergency. And we don't know when that will come yet. Secondly, practitioners with an already established practitioner-patient relationship may, in accordance with state and federal law, provide treatment to existing patients by means of telemedicine. And finally, should circumstances arise in which the public health requires approval of additional practitioners to initiate MAT via telemedicine, DAODAS, in conjunction with a qualified practitioner or practitioners who have obtained a Drug Addiction Treatment Act of 2000 waiver, may petition the board for such approval. The BME's executive committee may review these petitions. So it's not necessary for the qualified practitioner or practitioners to come before the full board to achieve that approval. And DAODAS has that process streamlined, and so if anyone is interested in going through that process, they can access that information through the DAODAS website. So now that we've reviewed all of the emergency orders touching upon telemedicine, it's important to keep a couple of things in mind. All of these emergency orders will terminate upon the expiration of the declaration of the public health emergency or upon further action of the BME. At this time, we don't know when that's going to be. So if you or an employee are practicing telemedicine in South Carolina, either via a DHEC waiver or pursuant to one of the temporary enforcement exemptions, you might want to be mindful that the licensure process takes time if you wish to continue practicing via a permanent license here after the pandemic ends. And that would be one way that you could be sure to have compliance because the pandemic's termination is rather uncertain. If you have any questions or comments, you may submit those at any time during today's session in the chat box, or you may submit those via email. I will participate in the dialogue in the chat box, or I will answer your questions gladly via email, or you may feel free to give me a call. The best number to reach me is my cell number, which is provided, 803-606-5880. Thank you again for your participation and your attention today, and it's been a pleasure to be with you and a pleasure to be a part of the Telehealth Summit.